Hi, I'm Dr. Russ Leftwich. I'm here to talk about the concept of FHIR. Without being too technical, beyond things that you need to know every day to use the internet, I want to talk about what FHIR is in healthcare data interoperability. And to start, I'm going to go back to the 1980s. That's when interoperability in healthcare began. And it began because hospitals started to have more than one system and they had to connect their systems to each other. It wasn't about exchanging data with other organizations. So the 1980s is when the standards development organization HL7 International was formed, and the first standard was HL7 version 2, which was intended to exchange information between systems within the hospital. If we fast forward to the present time, someone has observed recently that the average hospital in the US has over 80 IT systems within its walls. And we still need to connect those systems to one another. We will need to do so well into the future. But we all know that now there's data in a lot of places besides the hospital. There are more systems in the hospital, but there are also payers have systems. Patients have mobile devices and home devices that have data. Genomic sequencing labs have data. And there are an ever-increasing number of places that we find data about individuals. So today, interoperability no longer means connecting two systems. It means being able to be in one place and see all the data for an individual or a population of individuals from that one place in real time. It's the way everything else on the internet works, and that's what interoperability today means in healthcare. So not only is there data in more places, but there is a lot more data. And a few years ago, Dr. William Stead at Vanderbilt University wrote an article where he estimated the amount of data, the number of facts that existed for every complex decision we have to make in healthcare. His estimate was in 1980, there were about 10 facts per complex decision. Fast forward to the current time, and the exponential increase in data over that time means that in 2020, there are about 1,000 facts per complex decision in healthcare. And it continues to increase. But what hasn't changed is the number of facts that an individual can handle in making a decision in their head. And that is about 5. Maybe if you're really good, you can handle 8 or 9 facts. But that means you were behind in 1980, and like everyone else now, you're hopelessly behind. We can only solve that problem by making those facts about an individual's health and their health care if we make those facts computable. So it was that challenge that led the organization HL7 a little over a decade ago to appoint a task force and ask them the question, what if we created a new healthcare data standard from scratch? What would it look like? The existing standards were not capable of solving the problem that has emerged, and we knew that there needed to be a new approach to the problem. With that, a gentleman from Australia, Graham Grieve, came forward with the concept that we now call Fast Healthcare Interoperability Resources, or FHIR. Data had gone from offline to online. There were data transparency efforts around the globe, and data had become a mixture of narrative and coded data. And FHIR was designed to solve those problems. So what FHIR is, in its essence, is a representational state API, application programming interface. And those REST APIs are the basis of everything we do on the internet every day, Google and Twitter and Facebook. And perhaps the easiest way to explain it is your favorite travel website. So if you go to your favorite travel website and type in that you want to go from Boston to Los Angeles on August the 10th, you see a list of flights from different airlines in a matter of seconds with a departure time, price, and so forth. That's not because your favorite travel website has downloaded all the airline schedules. That is because the airlines have agreed on how to represent the data in an airline flight, what to ask and what you get back in return. That's that REST API, and that's what FHIR is for healthcare. It's the same technology, and it's the agreement on the meaning of the data. And that's where it gets complicated, because as you well realize, data in healthcare is far more complex than data in airline flights or financial services or many of the other things we do every day. So there are a couple of concepts that are important to understanding FHIR. The first is FHIR resources. That's resources as in URL. Remember, that stands for Uniform Resource Locator. So those FHIR resources have a known location on the internet somewhere or on the server you're on. They have a defined meaning. That's the FHIR specification that describes what the data model for each resource is. And inside those resources are data elements that are the concepts that are necessary to describe that data concept. So, for example, a patient has a given name, a family name, a date of birth, a gender, and so forth. All of the data elements that are necessary to describe that data concept, that resource, which in this case is a patient. So FHIR resources are things like medication, care plan, and some of the resources are what we call infrastructure resources. So there's a list resource, and whether you're making a list of patients in the hospital that a provider has or a list of medications for a patient, you use that same FHIR list resource. And there are other infrastructure resources and resources that allow us to make rules for the data for FHIR. That's the data model underneath FHIR that we call resources. And the next concept that is important is FHIR profiles. And FHIR profiles are the customization of the FHIR resources for a particular use case. So you create a FHIR profile for a resource for your particular use case. It contains all of the vocabulary, terminology bindings for that profile, the extensions, the FHIR extensions, and I'm going to come back in a moment and talk about that, and the rules for relationships between those resources and other resources in your use case. That's what a FHIR profile is, a customization of the base FHIR standard. And the interoperability in FHIR is not from using the base FHIR standard. Interoperability comes from systems using the same FHIR profile for a particular use case. So that profile defines the meaning of the data for that particular use case. What that means is that when you have expressed data according to a particular FHIR profile, you can exchange that data in different interoperability paradigms. So suppose we had a lab test result, and we get that lab test result from a FHIR API, and it is specified according to a FHIR profile. Then we can take that lab test result, put it in a message, and send it to another system. We can put it in a FHIR document that would be like a CDA document, and that data becomes part of that document without transforming it, or we can use that FHIR data that is a lab test result in decision support, because everything we create from a FHIR profile is inherently computable and machine readable. So 4 different interoperability paradigms without transforming the data. That can't be said of any other existing healthcare data standard. That is part of the power of FHIR. So we say that true interoperability is when we exchange data and we mean the same thing. But that doesn't really refer to humans meaning the same thing, but rather to systems meaning the same thing. Humans are pretty good at figuring out what another human means. As an example, let's say that 2 humans had never seen this animal before, and one of them says it's a white horse with black stripes. The other one says it's a black horse with white stripes. Well, they would figure out quickly that they mean the same thing, that they're referring to the same animal. But to a computer system, those are absolutely 2 different things. And the computer system cannot understand that those are the same thing. It's true that we could program our system to understand that they're the same thing. But in healthcare, there are many data concepts that have 2 or more possible meanings, and we can't possibly program all the systems to understand those multiple meanings. So that's where the idea of a clinical information model comes in. That is the description of the data for a particular use case. So it is the rules and the relationships between the data in that data concept, the vocabulary bindings, and if that's starting to sound like a FHIR profile, that's exactly what it is. A FHIR profile is an implementation of a clinical information model that allows systems to understand the meaning of the data. So have we had models before? Well, yes, there have been modelers for a long time, and we've used models without realizing we were using a data model. And let me give you an example of that. Suppose we printed out on a printer a history and physical about an individual. And then we took a pair of scissors and we cut that history and physical document into individual data elements. And we pick up one of those data elements, one of those pieces of paper off the table, and it says diabetes type 2. Well, we know what that is, but what we don't know is the relationship of that to the other data in that document. We don't know whether that's a condition that the patient has, whether it's a condition that they had before they had weight loss surgery and lost 200 pounds, or whether it's a condition their mother had and it was in the family history. So FHIR profiles tell us the relationship of the resources in that data concept to replace that document model that we're all accustomed to using for the relationship of data in a data concept. So let me give you an example of how a profile or a set of profiles might be used for a particular class of use cases. And in this case, it's a procedure, and that procedure might be a lab test procedure, it might be an imaging procedure, it might be a surgical procedure. All of them have similar content in terms of data concepts, FHIR resources. So each of the labels on the little logos you see represent a separate FHIR resource. So the FHIR resource, the profile for the FHIR procedure resource would contain in it the details of what procedure that is, and we can't see that from this 20,000-foot view. And the procedure is performed on a patient, the FHIR patient resource. The procedure is performed because of a certain condition, the FHIR condition resource, and the procedure is usually performed within an encounter, the FHIR encounter resource, and it is performed by a practitioner, so the FHIR practitioner resource. And for many procedures, there is a diagnostic report that is the results of the procedure, the FHIR diagnostic report resource. So the profiles of all of those FHIR resources would be what you need to customize FHIR to use in a particular procedure and make it interoperable so that the systems that are exchanging that data can understand it. Now, one of the things that is different about FHIR and makes it so powerful is that included in the FHIR specification are the concepts of a FHIR terminology server. So a terminology server that stores all of the value sets and the code systems and can manipulate those codes and value sets for the purpose of a particular use case are all stored on a FHIR terminology server, accessible by the same mechanisms that we access data in FHIR. And that means that we can share that server across different implementations, and they can all be referring to accessing the same value sets and terminology to make things more interoperable and more easily exchanged. And let me give you an example. Suppose you had an app that you had created that was for treatment of bacterial pneumonia, and one of the value sets that you would need would be all of the antibiotics that might be used to treat that bacterial pneumonia. You would then create that value set and store it on the FHIR terminology server so that others that are implementing your application for pneumonia treatment or other applications could reference that same value set from that same terminology server. Then you don't have to download all of the value sets and terminology to each system to use FHIR applications interoperably in those systems. Now, I said I was going to come back and talk about FHIR extensions. So FHIR extensions are the way you add a data element that's missing from the FHIR base specification. And it is by design that the FHIR base specification contains only data elements that are found in 80% of existing systems. The reason for doing this was to keep FHIR less complex, more easily implemented, and not try to include every possible data element in the base FHIR specification, but to include a way that you could extend the specification if you needed for a data element that was important to your use case that isn't necessarily in most systems. The FHIR extension mechanism specifies how you do this and requires that when you create a FHIR extension, you publish that extension, the definition of it, to a publicly accessible server URL so that anybody that receives data with that extension can understand what it means. So let me give you an example of a FHIR extension, one that's not clinical, but it would work the same way if it was a clinical data element that we wanted to add. So suppose you had a facility that was involved in medical tourism. You saw patients from other countries because you had particular expertise in a particular procedure. So you would want to know the nationality of those individuals that come from other countries to your facility, but nationality is not part of the FHIR patient resource. So you would extend the FHIR patient resource by adding a nationality element to it. You would share that extension definition so that it could be discovered by others, and then you would have the nationality in your FHIR patient resources that you need for your particular use case. That's the idea of an extension. It would work the same way if it was clinical data. That brings us to the end game of FHIR, and that is the FHIR implementation guide. Now, the FHIR implementation guide is actually a FHIR resource that specifies how you construct this resource, how the data in this resource is represented. The FHIR implementation guide is created for a particular use case, and you specify in that implementation guide all of the FHIR profiles you need for that use case, all of the value sets and code systems that you need for that use case, and all of the FHIR extensions that you need. There is also, in addition to that content, a human-readable description of what that implementation guide is used for and examples of how that implementation guide is used. And then those implementation guides can be published. using a web publishing tool that's available on the HL7 website. So they are published to a URL that anyone can access and download that FHIR implementation guide if they're creating an application in the area of that particular use case, and their application will be consistent with other applications using that FHIR implementation guide. That also means that you download the machine-readable content of those FHIR profiles, extensions, and value sets, and your implementation, your application, can be validated against that machine-readable content, that it is compliant with the implementation guide. So one of the things that is very different about FHIR from previous standards is that the entire FHIR specification is machine-readable, downloadable to your system from the FHIR website, and everything you create with FHIR is also machine-readable, meaning it's much easier to share that content between different systems, between different implementations, and to thereby create interoperability. That is one of the game-changing, if you will, features of FHIR, this machine readability of everything. Prior standards were published as documents and had to be read and interpreted. So that brings us to the overview of the entire FHIR specification. It is being implemented in many places around the world. There is no killer FHIR app because, in fact, different use cases need different FHIR profiles, different FHIR implementation guides. But FHIR is a familiar technology to software engineers and computer scientists, so they can rapidly learn to develop things with FHIR and implement them in their own systems for their use cases that are important. The idea of portability of apps across different systems is challenging because the data in different EHR systems and other systems looks different in different organizations, because different organizations have customized their EHR system. They have a different formulary in their pharmacy from another organization. They are connected to different lab systems that represent lab test results in a different way. It makes challenging the idea that we would have apps that can simply plug and play in different places. But FHIR does make it easy to create applications usable in your environment and in your organization and to innovate. FHIR is probably the greatest healthcare data innovation of the past decade, and it makes possible innovations in the future using the FHIR specification. So thank you for your time today, and I hope that is a good overview of the concept of FHIR.